hit him out of the head. I mean, everything that's happened in Washington, the procedures that we've gone through, the target date was to get it done by July 31st. The good news is the Democrats in the House couldn't do that. And it gave us the opportunity. It was great. It gave us the opportunity to come back home and sit here and meet with you in these town hall meetings that you see across the country and sit down with our constituents and talk about this bill. And we've developed an incredible groundswell. The dynamics of this bill have changed dramatically over the month of August. We've got the wind behind our back and our sails now. We need to keep pushing forward. Very briefly, H.R. 3200. Again, I mentioned the three problems I have with it. Debt, taxes, public option. Here's the taxes. $800 billion over 10 years. $208 billion on small businesses. Now, this is 8% payroll tax on a small business that provides health care to its employees, but doesn't provide it to the standards that the federal government determines. Or they don't provide it, or they don't have a big enough match. And again, 8% hit on small businesses in America on payroll tax. Wrong time, wrong, this is the wrong way to resolve our health care issues. Surtax on small businesses. You know, they say that this is the tax on the rich. Don't be fooled by that. This is an income tax on, again, it's an attack on small business. It starts at $350,000. It works its way up increments up to $1 million. Again, these bills are attacking the small businesses, the economic engine of America. They're a bad idea, a wrong place at the wrong time. One other surtax that Dean mentioned as well is there's a pay-or-play mentality in this thing. Either you sign up for the government, the public option, or you have some private health care, or you're going to pay 2.5% income tax. You don't have the option of staying out of the system. Next slide. You've got this is get back down to the public option. You've got a health advisory committee, which is going to determine which healthcare services are going to be required of the entities that participate in the healthcare exchange. The healthcare exchange, the way the president talks about it, he talks about it very democracy. And when he says it sounds kind of good. He says, you know, we're just going to, the public sector is going to compete, be a competitor there with the private sector, just to keep prices low and, you know, we get the benefits of competition, which all of us in this room, I think, realize competitive competition is what's made our country great. But what the president doesn't tell you is it's not a fair competition. The private sector cannot compete fairly with the public sector, with the government. The government makes the rules. They're going to determine who gets in, who gets out. And as I mentioned earlier, infinite source of money. If they go into debt, it doesn't matter. Just fire up the printing presses, print more money. So it's not a fair competition. You've also got a comparative effectiveness research commission, which the goal of this thing is to, and there's $1 billion put in the bill for it, but to basically look at research, do research on treatments that are given to people, and over time develop some data that's going to limit health, that's going to result in healthcare rationing. Basically, well, this treatment was effective, this one wasn't, and again, they will start making the determination of what your healthcare should be instead of your doctor and you in that treatment room. And that's fundamentally wrong. American healthcare has always been your doc, you make decisions. And we need to, again, fight hard to stop this. Please, next slide, please. A big part, I guess this is a good time to talk about some of the things that people on my side of the aisle talk about, some solutions. And don't be fooled by the other side saying we don't have solutions because we do. We can do some things through small businesses that tremendously help this problem. We should let simply situated small businesses pool together for insurance purposes, go across state lines, drive the cost down so they can provide health care to their employees. Just an example of that is, you know, say a gas station. They have 10 employees, there's another couple of gas stations down the road, very similar, they have the same sort of risk, they do the same job. And so if we can let 30, 40 of them pool together, 50 of them, all of a sudden you've got 500 employees in the pool. If you cross state lines, it's going to be a much lower cost. It's going to be, I'm sorry, what did you get right there? We pool you, we can drive down that cost and allow you to provide health insurance for employees. We need to make sure that small businesses have the same equitable tax treatment or equitable tax treatment corporations. There's a lot of corporations. I mean, corporations to take on the trial wars. It's costing us millions, billions of dollars. Our state has proved that medical malpractice reform, tort reform works. And we can take it again. Texas tort reform and take it to a national level. Next slide. Here's just some numbers. Defensive medicine increases medical costs by 10%. 214 billion is the estimate. We take that tort reform national, we save that money. 83% of the physicians are practicing defensive medicine. And unfortunately, I've talked to some across the district who have done that or who worry about that every day. They have a treatment, they have an examination, say they used an ultrasound, about 90% effective. But they see something they think, that's not anything to be worried about. We've got a 90% chance to get right here. But because they're worried about getting sued, they go ahead and run that $10,000 MRI just to make sure, just to get about another 4 or 5 percentage points of surety. That is expensive. Tort reform works, and it's worked in our state. It's dropped premiums by 35%, $217 million in cost savings for doctors and providers. We got to take that on a national level. Next slide, Pete.